Hi students, today let's learn about diseases caused by virus. First let's see what is virus. A virus is a microorganism that lives in a cell of another living thing. What's the size of virus? It's about 0.01 to 0.3 micron. Virus can be seen only with an electron microscope. With the naked eye, we cannot see them. Viruses are a major cause of diseases. They are the major cause of diseases. The first one is common cold. It is the most common viral disease. Common cold is the most common viral disease. Causative organism of common cold is rhinovirus. This virus attacks mucous membrane of nose and throat and causes high discharge through the nose. This rhinovirus attacks mucous membrane of nose and throat. Because of that, this virus attack on the mucous membrane of nose and throat, what happens? We'll have high discharge through the nose. Nasal congestion will be there and lot of discharge will be there from the nose or through the nose. Okay. Now symptoms are runny nose, sore throat and cough, sneezing, slight body aches or mild headache, low grade fever. These are the symptoms: runny nose, sore throat, cough, sneezing. Slightly we will have body aches. Then mild headache and low grade fever. How it is spread from one person to another? By droplet infection. An infected person cough or sneeze. When an infected person cough or sneeze, by their droplet, the organism spread in the air, and that a healthy person breathe in, and they will get the common cold. What is the treatment of this common cold? It's just symptomatic treatment, like drink plenty warm water. When you drink warm water, it eases the congestion and dehydration. Okay, it prevents dehydration. Lot of fluid we will be losing through the nose because of this common cold. So if you drink warm water, you can prevent dehydration. And when you drink warm water, the nasal congestion will be released, or it eases the congestion. Then when you gargle with warm water, warm salt water, and if you have sore throat, that will be healed, or sore throat will go away. And then 8 to 10 hours sleep. It is very important for a person who has common cold should sleep 8 to 10 hours. And rest is also very important. What is the treatment for this common cold? Symptomatic treatment like drink plenty warm water to ease congestion and dehydration, gargle with warm salt water if you have sore throat, 8 to 10 hours sleep, and rest is very important. Second one is chicken pox. What is chicken pox? It is a highly contagious viral infection which causes an itchy rash with small fluid-filled blisters. If you get chicken pox, on your body there will be itchy rash with small fluid-filled blisters. It is very contagious viral infection. The causative organism of chickenpox is varicella zoster. Varicella zoster. How chickenpox is spread? It is spread by droplet infection through coughing and sneezing. When an infected person cough or sneeze, by their droplets, this infection is spread from an infected person to a healthy person. Then in that healthy person, this virus develops chickenpox. Then treatment. Treatment is symptomatic and antiviral medications are also there. When rashes or itching will be there on the body, they will apply lactocalamine so that it soothes the body. Then you should drink plenty of fluid so that the body will be cool. Then third one is smallpox. It is an acute contagious disease which causes severe rash with blisters that appears first on the face, hands and forearms, and then later appears on the torso. What is torso? Torso means the main part of the body, that is chest, abdomen, pelvis and back. That is called torso. What is smallpox? It is an acute contagious disease. What causes it? It causes severe rash with blisters that appears where? First on the face, hands and forearms. Then it appears on the chest, abdomen, pelvis and back. What is the causative organism of smallpox? Variola virus. Then what are the symptoms? Symptoms are fever, anathema. What is anathema? Anathema is nothing but ulcer or eruption. Eruption where? On the mucous membrane of the tongue, and severe headache. These are the symptoms of smallpox. How smallpox is spread? It is spread through prolonged face-to-face contact via droplets expelled from the patient's nose and mouth, usually by coughing and sneezing. Then smallpox may also be transmitted through contact with materials from smallpox. What materials from the smallpox? That is pustules. That is, what is pustules? Pustules is small blisters which is on the body. Okay, that is filled with the fluid. And otherwise, what? Scapes. What is scapes? Dry, rough crust will be there on the blisters. That is dry, rough, protective crust that forms over the blister. That is scapes. Okay. How it is transmitted or it is spread? Through prolonged face-to-face contact via droplets expelled from the patient's nose and mouth, usually by coughing and sneezing. Smallpox may also be transmitted through contact with materials from the smallpox, that is pustules. What is pustules? Is small blister, or scapes. Scapes, that is dry, rough protective crust that forms over the blister. Okay. Now what is the treatment for this smallpox? That is symptomatic and antiviral drugs. Antiviral medications are there that help the patient to get all right. And this rashes cause, skin will be there. The smallpox marks will be there. Scars will be there. This disfigure the skin, because very big blisters will be there on the skin. That makes a scar on the skin which disfigure the skin. Fourth one is poliomyelitis. We call it polio. Poliomyelitis is a highly infectious viral disease that largely affects children under 5 years of age. What is the causative organism? Poliovirus. Poliovirus is the causative organism of poliomyelitis. What are the symptoms? Symptoms are fever, fatigue, headache, vomiting, stiffness of the neck and pain in the limbs. These are the symptoms. How it is spread? It is spread from person to person through contact with the poop of an infected person. Poop is stool or motion of an infected person. It can also spread through the sneeze or cough. Then it usually enters the body via alimentary canal, where it multiplies and reaches nervous system through the bloodstream, and that is how it is spread in the spread from one person to another, and it causes this poliomyelitis. How it is spread? It is spread from person to person through contact with the poop of an infected person. When an infected person passes motion outside the house or in the open field, that is why open field defecation is not good. We don't know which person is infected and which person's motion is that, we don't know. So when we step by mistake and we carry this virus, and then that end up in poliomyelitis. Spread from person to person through contact with the poop of an infected person. It can also spread through the sneeze or cough. When they sneeze or cough, this droplets will be expelled. Through that also we get this infection. Usually, this virus enters through the alimentary canal, where it multiplies and then reaches to the nervous system through the bloodstream. What is the treatment for poliomyelitis? Since there are no treatment to cure this disease, for these patients we use supportive treatment, which include bed rest, pain relievers, hot moist pack to control muscle pain and spasm, portable ventilators to help with breathing, physical therapy exercises to prevent bone deformity and loss of muscle function, splints or other devices to encourage good position or alignment of the spine and limbs. There are no treatment to cure polio. The best way to fight it is to get the vaccine. As I told you, there are no treatment to cure this disease. So, usually we give supportive treatment, which include bed rest, pain relievers. These patients will have severe pain, muscular pain. Okay, for that they need to get pain relievers. To prevent muscle pain and spasm, or to control, not to prevent, to control muscle pain and spasm, we have to give them hot moist pack, so that the muscle pain and spasm will be controlled. Okay. Then portable ventilators to help with the breathing. These patients will have breathing difficulty, so they need ventilators. Which kind of ventilators? We give them portable ventilators. Physical therapy exercises. They need physical therapy because this disease is affected in their muscles. They'll have severe muscular pain and spasm will be there. So, slowly they will start with physical therapy exercises to prevent why? Bone deformity. They are prone to get bone deformity. To control or to prevent that, we need to give them physical therapy exercises. And loss of muscle function. Muscle function can loss. So to prevent that, physical therapy will help them to prevent this muscular loss of muscle function. Then splints or other devices to encourage good position or alignment of the spine and limbs. We already said that, we learned here that there will be bone deformity. Okay, there is stands for bone deformity. So they need to get splints or other devices for what? To encourage good position, alignment to be kept, good alignment to be kept for the of the spine and limbs. So they need splint support or other devices which help them to keep their position in good position or good alignment. There are no treatment to cure this polio disease. So what is the best way to fight it? To get the vaccine. Fifth one is rabies. What is rabies? A deadly viral infection that spreads to people from the saliva of infected animal. Rabies is a deadly viral infection that spreads to people from the saliva of infected animal. Now, what is the causative organism of rabies? Lissa viruses is the causative organism of rabies. Symptoms: fever, headache, hydrophobia. What is hydrophobia? Hydrophobia is fear of water. Hydro refers to water. Then phonophobia. Phono refers to sound. Fear of sound. Phonophobia means fear of sound. Excess salivation. Too much of saliva will be there in the mouth. Then muscle spasm. If the person is infected, then they will be having muscle spasm. Paralysis and mental confusion. Symptoms of rabies is fever, headache, fear of water, fear of sound, excess saliva, muscle spasm, paralysis and mental confusion. These are the symptoms of rabies. How rabies is spread? Rabies is spread usually from the bite of the rabid animals like dogs, monkeys, cats or rabbits. That is why if you are keeping these animals at home, domesticating these animals, then you should be very careful. If you get even a scratch on your body from their nails, or if they bite, immediately you should reach to the hospital. Then it is also possible but rare for people to get rabies from non-bite exposures, which can include scratches, abrasion or open wounds that are exposed to saliva or other potentially infectious materials from the rabid animals. Not only from their bite we get infection, even from their saliva or other potentially infected materials from these rabid animals. If you have scratches or abrasion or open wounds in our body and that exposed to this saliva or any other infected materials from these animals, then there is chance for us to get rabies. What is the treatment? Immediately we should reach to the hospital. Seek immediate medical attention after a bite or suspected bite. That is the best way. Then we will have a vaccination. A vaccine can prevent infection. We don't know the animal is infected or not. So immediately we should go to the hospital and take vaccine so that we can prevent the infection. Once we are infected or once a rabies infection is established in our body, then there is no effective treatment for this. It is nearly always fatal. That means no chance for us to be alive. If you like my video, please like, share and subscribe. Press the bell icon to stay tuned.